So, all right, welcome. Good morning. We're on our day 2 of the Fall Bladder Cancer Summit. Again, it's just a delight to see so many of you here. I hope that you're either using that bingo sheet or your little notebooks to keep track of the people that you're meeting so that you can follow up. You've got new friends in the room, and I'm just delighted to welcome some of our longtime friends up here on stage. Obviously, you all met Mary Dunn yesterday, and she has been a friend of Beacon for forever. Since she got into the water closet many years ago, she has been part of Beacon, and I would like to welcome some of our other friends, David Langham, Lori Roscoe, and Karen Godfrey. And we've got, kind of a mix because we've got some long-term survivors who've been doing this for a long time. I will tell you that Karen was the very first Beacon volunteer that I met back in like 2006 when I was working at the AUA, and I would offer to do partner programs with Diane Qualley, and she would say very rightfully, only if it's a bladder cancer program, no GU oncology programs. And I took a picture that we still have of Karen with the little table with all the Beacon stuff at that very first meeting in Florida. So I've known Karen for a really long time. And so there are just so many important things to talk about. And I just want to point out, we've said this before, but each journey is different. The road to survivorship, the road to thriving is different for every single one of you. There's no clear path. You got to roll with the GPS when Siri says there's a shorter way. Pay attention, but maybe, look at those road hazards and see which way you want to go. Involve your care team, be a partner with your care team. Bring your loved ones along. They can be the navigator. They can be your advocate. They can speak up for you when I don't know what to say. I'm a little embarrassed. I don't know what questions I want to know. 4 ears, always hear better than 2 ears. And if 2 of those ears are also taking notes, that's a good thing. We have a great patient panel. We have 1 man and 2 women. That's not how this happens in the real world. There are more men with bladder cancer than there are with women. So I would ask that all the women with bladder cancer, please stand up just so you can see each other. So we got a pretty good group of you here. But, we're really dealing with kind of 3 to 1 in the ratio overall. And I want to remind you, thank you so much for standing up. I appreciate it. I want to remind you that one of the programs, the resources that Beacon started this year, and I'm really proud of it, and it's a wonderful opportunity, is our Female Focus online support group. We meet the first Tuesday of every month. And I'm pleased to say that Karen Sachs, with her experience not only as a nurse, but as a bladder cancer individual herself, is one of our 2 moderators, along with Miriam Pomerantz, who is an oncology social worker. And she and Karen and I, and now Patricia, join that group. And you do see that in our monthly bulletin to remind you to register. It goes out every month. But we meet the first Tuesday at 8 p.m. Eastern time for like 90 minutes. So it's a great opportunity. Is it 8 p.m. or 7? 7 p.m. Okay, sorry, 7 p.m. It just feels like 8 p.m. But anyway, we do this online group, and it's wonderful. Granted, it's not in person. That's why we do these summits. But it's just a way to be in a Zoom room with people that know what you're going through. So this is great. So cancer changes you. We've said that. I've said that a couple of times. It impacts your mind and your relationships, your body, obviously, and your emotions. It can even change you spiritually. There's so many dimensions that are impacted by a cancer diagnosis. A bladder cancer diagnosis is a little bit different in that you don't always feel comfortable talking about it. You know, people are like, bladder cancer? I've never heard of that. Or the other thing I hear, well, when I say I have bladder cancer, people say, you don't look sick. You know, if you're being treated intravesically, you're not showing the ravages of cancer. People don't know what you're going through. And then when you tell somebody, sometimes they say, well, you know, they took it out, so you're good, right? But they don't know that bladder cancer and that threat of recurrence is like bad music from an elevator that's always in the back of your mind. So what I'm going to do is kind of go down the line and ask each of our patient advocates to introduce themselves and share a little bit about their stories. And then I've got 4 pages of questions. So we're going to get to as many as we can. And and if I forget something, Mary's going to bring it up. So Karen, we're going to start with you. When were you diagnosed? Tell us a little bit about that. You know, how did you find Beacon? But, you know, share, because one of the things that we find with women with bladder cancer is they're not necessarily tuned in to going to the urologist. That's my husband's doctor for his prostate. They don't think about that. They go to their GYN or their general practitioner, and they don't have the equipment to treat or even diagnose bladder cancer. So when they see signs like hematuria, blood in your urine, the first thing they do is write a prescription for antibiotics. And maybe you go back for multiple rounds of antibiotics before they finally say, gee, maybe you should go to a urologist. Well, duh. You know, meanwhile, your cancer's been sort of percolating all along. So women typically have a more advanced diagnosis and sometimes worse outcomes because they don't get into care as quickly. But Karen, well, I'm going to stop talking.
Good morning. Since I'm holding a mic, if you don't hear me, raise your hand and I'll move it around. Otherwise, I may make a mess of this.
We can hear you.
Okay. I am such an old timer, and I've told my story so many times that I feel like a lot of my issues are really not pertinent today because things have changed. But you know, the story that we're trying to tell this week or this weekend is the pathway and the journey and the pitfalls and the roadblocks. And my story put me on a path that had no map. It had no traffic on it. I was on there by myself. My doctor told me, you're going out on this detour, and I'm here and I'll tell you, you know, what we need to do. And I thought, okay, I'll learn as I go. And that's exactly what I did. There was nobody to talk to. There was nobody to ask questions except for my doctor. I was diagnosed with T2 muscle invasive at the very beginning. I had gone to my regular GP for what I thought was a UTI. And when medications didn't stop that, I was sent to a urologist. I lived in a small town in Southwest Florida, having moved down there in 2002. And I tell everyone I am the most fortunate of people. The general practitioner picked a urologist to send me to, and this guy had done his training in Chicago and had come back to Florida to join his practice. And I did not know until about a year and a half after my surgery, he was the only one down there in my area that could do the Indiana pouch. And that's what I have. He has followed me. He was my doctor to diagnose me. He was the doctor who did my surgery, and I still see him. So I am most fortunate. Okay, that's enough for me right now.
Okay. Lori, you had a unique situation. Thank you, Karen. In that Lori was diagnosed at the beginning of COVID. So while you didn't have anybody because nobody knew about this back, what year was that?
2003.
2003, before Beacon even got started at Diane and John's kitchen table in Bethesda, you were already on your path. Lori was on a path by herself because everybody was quarantined. Go ahead.
Right. Well, I was first diagnosed in 2018, similar to what Karen said, blood in my urine, UTI, antibiotics 3 times. The third time, my primary care doctor said, I'm sending you to a urologist. I said, you're going to have to drag me there. I'm not doing that. I've never been sick. I don't have cancer. I'm not doing this. And she pretty much begged me. And so I really credit her with saving my life. She said, do it for me. If you're not going to do it for yourself, do it for me. The urologist said, there's 100 reasons why you could have blood in your urine. Only one of them is cancer. You probably don't have cancer. Did a cystone, said, guess what? You have cancer. I'm like, oh my God. It's like when people say you hear that word, it was like someone put a pail over my head and was banging on it, And I didn't hear anything else. And he's like, oh, we could do this and this and this. I'm like, hold it, Ended up transferring to Moffitt Cancer Center. I live in Tampa, which also makes me one of the most fortunate people because it's only 20 minutes from my house. Excellent, excellent care. Did BCG for almost 2 years. I found that experience to be excruciatingly anxiety provoking because you live your life in 3-month segments. And my anxiety had gone, similar to Dr. Joshi's talk yesterday, that was me on the screen. I couldn't function. My anxiety was about bladder cancer was more difficult than the disease because I really didn't have any symptoms. So I had a recurrence. Again, my doctor said, little bladder irritation, probably nothing. I'm going to biopsy it. 99%, I'm like, these statistics are not working for me. Like, you told me it wasn't cancer. I'm a woman. I never smoked, blah, blah, blah. Recurrence. And he said, I think we should remove your bladder. And I'm like, going to have to kill me first. I'm not doing that. But he was very patient, and we set up appointments just to talk, which I really encourage anyone to do. Your doctors they're very busy, but if you call and say, I need a half an hour of your time to talk through this, they will do it. I've done it many times. I got 3 other opinions because I was hoping someone would tell me that they were wrong and that this whole thing was a bad dream. Somewhere along the line, I ended up having a radical cystectomy right at the beginning of COVID, as Stephanie said. My husband was allowed to come with me during the surgery, but toward the end of that week, they were threatening to make him leave. And I said, you're going to be sorry, because he's doing a lot of the caretaking. Meanwhile, he was subsisting on peanut butter and chocolate pudding from the nurse's station because I wasn't allowed to eat. The first time I was able to order food, I ordered so much food. They're like, wow, that's an awful lot of food for one person. I'm like, well, I haven't eaten in a week. And I'm like, I need 2 cheeseburgers, a lasagna, and 3 milkshakes, and don't question it. So I did hear about Beacon somewhere along that road. Kind of early on, I got a folder with a lot of information in it. I found it completely overwhelming at first because I didn't want to be on this journey. I wanted it to be a one and done thing. Okay, I didn't want any of this. I mean, not that any of us do. But I was really in denial. And as I was able to digest the Beacon information, I realized, yes, I'm on a journey I don't want to be on, but Beacon, really a beacon, it's a healing journey. And it's a journey toward healing. And that it is not easy, it's not always pleasant. It can be extremely frightening, but there's a beacon there. Literally, there's information, there's people to talk to, and this is a journey toward healing and toward resolution, however that looks. I'll stop there.
Great. Thank you, Lori.
I'm David. You all know that. And I'm nervous, so I'll say that and then get over it. Thank you. Thank you. So I I was flying to one of my sons and his wife and 3 kids live in Alaska. And I was flying to Alaska. It was a long trip. We had a lot of layovers and so forth. And I got up there and started seeing urine, blood in my urine. And it wasn't just little drops. It was like, you know. And I thought, this is really strange. Something must have happened to my body while I was flying. Maybe it was the
Turbulence.
yeah, thank you. The turbulence.
Yeah.
It was the turbulence,
Definitely.
you know. And so I said, oh, it's going to go away, you know. And then, you know, I just didn't say anything to anybody. Didn't tell my wife, nothing, you know, because I'm a guy, you know. And then got back home, and you know, I thought, okay, I'm okay. I haven't seen any in a day or 2 or 3. And then I'm at work, and I go to the bathroom, and there it is again. And I go, oh, it's still from the, you know. And this went on for a while. I would say 2 or 3 weeks, maybe. Finally, I said something to my wife, and she said, "Oh, we ought to go get that checked out," you know. So I went to my family doctor, and she's great. She's really good. Well, she's retired now, but she's great. And she immediately sent me to, well, let's say within a week I was at the urologist, and within the next week I was in the surgery. I mean, they moved me right on through. And that was great. It was wonderful. So they took, I still had my bladder. I was high grade non-muscle invasive. And so they scraped all that stuff out of there and got me all done. Then I went through the BCG, and I can't quite, okay, this is 2007, so it's a little ways back. I'm trying to get the sequence together here. But there was something weird about the doctor, and I can't really tell you, and I can't really explain it, except I didn't have a comfortable feeling. You know, there was something odd. And I'm the kind of guy that, you know, if I commit to something, I'm like, I'm doing this path unless, you know, something terrible happens or whatever. So I wasn't feeling like I should ever change. I was, you know, oh, I'm going to hurt his feelings, you know, blah, 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 blah. And I started talking to my wife, and she says, she was working at UNC Hospital at that point. And she said, let me talk to some people. And then she got me over to UNC. And I later learned that the doctor that I had picked no longer is in the business. So there was something going on. And what I heard was there was some family stuff going on with his father and, you know, that kind of stuff. Anyway, I ended up going to UNC, ended up having lots of BCGs, which are terrible. And then I ended up having a recurrence in 2009, more BCGs, and I haven't had anything since.
That's good. So 2 cystectomies, 1 intact bladder. You still go for surveillance.
The next month.
Yeah. So let me ask a quick question. How long was it before bladder cancer wasn't the first thing on your mind when you open your eyes in the morning? How long until you kind of settled into living with bladder cancer that it wasn't the first thing in your mind?
Oh, I'm trying to remember that far back.
Yeah.
I would say really for most of us, we've got that 5-year mark in our brain because everybody talks about cancer and being free for 5 years. Probably a little bit before that, I had settled down and was okay. But you always have this something in the back of your mind that, okay, I've had it, it can come back, or it can move to another area. So maybe 6, 7 years. And then I kind of slipped off into this area like I'm okay. And it's very rare that I even think of myself as being any way different now.
Well, I'm a little less far along, and I still think about it pretty much every day. It's different because now I think whatever, when I go for a scan or something, I think, well, whatever is going to be discovered, it's already happened. So there's no, yes, I can be nervous about it, but it's already happened. And part of this was sort of a hard lesson because 6 months after I had my bladder removed, I was diagnosed with lung cancer. 6 months after that, I had my hip replaced. That surgery broke my femur. So I had a second surgery to repair my femur. Yeah, you should see this leg. I mean, it's a mess. That surgery led to a septic joint infection. So that was the third surgery. And then after that, I was diagnosed with melanoma. So I kind of figured, like, yeah, I don't feel out of the danger zone at all, really. I just feel, but I feel about 1,000 times more resilient and stronger because I've done it. And gosh, I don't want to go into another OR, please, God, anything but that. But I know I can if I have to. So, but yeah, it's still, I'm still in the very, I see dermatologists 6 times a year. I see my urologist twice a year. I see my, who's the other one? The lung doctor. I just had, I'm like, these, so I think about it a lot still, but with not the same anxiety. So that's a blessing.
You're freaking amazing. I'm serious. I am serious. I think about it a lot. I mean, when did maybe 5 years, I don't know. I don't really know. But I do, I know the scan's coming up. I'm already going, and that's probably a month away, or it's been a month away, and I still think about it. Scanxiety, yes, somebody said it.
Scanxiety, yeah. And raise your hand if scanxiety is an issue for you.
And one thing that has been a tip for me, I don't know, I see myself as a realist, and for me to be calm and collected, I look like when I would go back for my test, well, I had it and I was diagnosed, it's probably back. So when I have my test and it's free and clear, I think, whoa, I missed it again. So great, I'm okay. So it's worked for me to be thinking, yeah, it's probably back. And then when it's not, I'm ready to relax. So that's what works for me.
Mary, how typical are these folks?
Quite. I ask folks as part of my practice, no matter how far out they are from diagnosis, how often are you thinking about your cancer experience? Is it something that you're thinking about so much that it's interfering with your day-to-day activities? Are you losing sleep over it? Do you feel like you can't move forward because your cancer experience is at the forefront of your mind? And I get very varied answers to that question depending on where folks are. But I think it's important to recognize what are some coping strategies that folks have that they teach me, and then I can share with my patients, which I think is valuable. I learned so much from every single day with every single interaction, but it's always something, and it's hard for folks, no matter which stage, right? Non-muscle invasive, muscle invasive, or advanced disease. I mean, I talk to folks a lot of times who have urostomies, and they say, it is a 24/7 reminder of my cancer experience. That is hard. And we do a really good job in the breast cancer world of talking to women about body changes and things like that. We don't do a great job of talking about that always in the bladder cancer world, but that's a constant reminder. If you have to catheterize yourself 5 times a day, that's a constant reminder. Every time that cysto appointment pops up on your mind chart, that's a reminder that you have this bladder cancer experience. And I find that a lot of people, the passage of time is helpful, but there's, of course, other resources and coping strategies that people have taught me over the years. Steph, if I may?
Yeah.
Laura, you brought up something that is always something that I'm curious about from my side of the street as a provider, about this information overload, that people were giving you information and you're just like, I'm not ready for it. And we had a really nice, robust discussion yesterday around the peristomal hernias. We talked about a lot. Like, no one told me I could get a peristomal hernia. So just kind of wondering if what your perspectives are of when we should be giving what information at what intervals, because that's really hard, because you've got that like big visit when you're first diagnosed. We give you a lot of information. Everyone tells me I heard maybe 20% of what you said, right? And that's hard. So just kind of wondering what, in an ideal world, what that delivery of information would look like for folks.
It's like going on a road trip and somebody gives you a box of maps. How is that helpful?
Yeah.
Pick one route and set out on it. What I love about GPS is it reroutes you. If you decide to take the scenic route, it tells you how to get there from the scenic route. But all these maps don't help because you don't know which map to pick. So,
I don't think there's an ideal way to do it. I was happy to have the information, even though I couldn't look at it right away. I knew it was there. If I needed it, it was useful for my husband as my caregiver. So I don't think there's an ideal way. I mean, I think because the whole experience is overwhelming, no matter what you do as a provider. It just is, and you don't hear it. After you hear the C word, you just don't hear anything. So I think it's helpful to know what the steps are, even though you hope that you won't have to experience them. I just don't think there's a right way to do it as a provider. I think giving the information with the sort of caveat, look at this when you're ready, call me when you have questions, we'll talk about this at your next appointment. I think that's really what you can do. I don't think there's a perfect solution myself.
Mary, I believe that we have more medical professionals that give us not enough information rather than the overload. At the very beginning, it's an overload just saying you've got cancer. But when it comes to how we're going to treat you, we're still at a place where we don't get enough printed material, we don't get enough information, we don't have enough time with the person in the office. You're one of the people that we wish we had in all of the urology
we want to
offices.
clone her.
Because you're concerned about how you can best inform us and help us. But we're all different. And some of us want to know everything. I really want to be told what the cons and the pros are so I can decide. But sometimes people, they don't want the pros and the cons yet. They just want to say, okay, what do you think I should do right now? And then maybe 6 months later, they're ready to ask the other question. So it's the way you sleuth it out that really helps us because we're all so different.
So meeting people where they are.
Right.
Yeah.
But there are so few of you out there for us. So I want to say thank you for what you're doing.
Oh, you're welcome. Thanks, Karen.
I'm just the opposite. I don't want to know.
It's true. Vouch for that.
And my wife wants to know every single detail down to the little.
All of it. Yeah.
I would say the one thing that was a real negative in our early experience at UNC was we had a resident who came in and told us, we asked what are the statistics, and the way he presented it was very life-threatening, and I think that was it put me like, oh God, I'm gonna die, and instead of leaving feelings lifted up or like it's going to be okay, we just got to get through the process kind of thing. Yeah. So that's the one thing, and the way I learn is, or the way I process things is, I hear something and then I have to sit with it for a day or two, and then I have to hear it again. So I know it's not feasible, but it would be really ideal for a person like me to have a second appointment to then then go over again that material that was presented the first time when my head has processed it a little bit.
Yeah.
Yeah.
That's ideally.
Yeah, ideal.
That's ideal. Yeah.
You don't always know what you don't know at that first thing.
What to
And then
ask.
as you begin to sit with this, those holes come up like, I wish I asked this question. I didn't even think about it. Or I kind of need to know about this. And so there are certainly many unknowns out there, and when doctors tell you everything, it's kind of like when they talk really fast on those commercials that tell you all the potential side effects of a particular drug, and you can't understand a word that they said, but they got it in there for legal purposes. But then when you're home and you're experiencing, it's like, they never told us about this, saved my life, but they took away some of the best parts. And there are consequences to anything that the medical system does to your body. You can't just change one thing and expect the rest of you to adapt. It's not that simple. And so it's kind of like you're driving on the highway and you hit a pothole and you get a blowout on your tire, surprise, and you feel it, womp, womp, womp. You're like, oh, gotta pull over. Tell me about a pothole that maybe you hit during your treatment phases and how did you deal with it? David, I know you had a pothole.
I don't know which pothole you're thinking of, but I've got maybe a different one in mind. But
Yeah, you said something about anesthesia as being
okay, then I have two of them.
Okay, now you have two. There you go. Okay, I know. I'm just taking notes.
One of them was waking up from the anesthesia and feeling like I couldn't breathe, and it was terrifying. I mean, this was the first time, and so I was very fortunate. The second time I had to go in, because I've had 5 times that I've been put under anesthesia for this, and the second time the anesthesiologist came in and she says, "Hi, David," and it was a friend of mine. And I said to her, I have this problem, and she said, "We'll take care of it." So, and then I didn't have that experience again. I don't know whether it was psychological or whether she actually did change something. I suspect she did. But it was really good that, even if it hadn't been a friend of mine, I would have said something. And then the other thing that I wanted to bring up was, this is for the guys. I have a hard time with every cysto with my prostate. And I don't know if other people do, other men do, but every time that thing hits my prostate, I feel it. And they can put all the numbing stuff in there they want, but it doesn't help through that part of it. And so that's part of what makes me really nervous about going, because I know that's going to come. One time, and I try to breathe and I try to do all the stuff that they tell you to do. The best experience I ever had was, because I'm watching this, on the TV, because I can see it in the exam. And one of the best experiences I ever had was when a nurse, when I got right almost there, this nurse started tickling the bottom of my foot. And it just totally took my mind completely off of what was going on. And it just went right on through.
Now you learned something new, Mary.
What else happened? Right? I have a lot of questions. A lot of questions about this. The power of distraction.
That's right.
So it's. I'm glad you brought. Well, am I glad you brought that up? I don't know. I'm undecided. But there are data that show that for people who watch the screen, if you have to have a cystoscopy, that you're so distracted by what's going on that it's less pressure. You feel less pressure and pain because of the distraction. Yeah. I think that's not there are data, but that's not true for everyone. Right? It's not true for men. And I hear this a lot from men who still have their prostates. So do what works best for you. Like we've got people who come into the cysto suite and they bring like full on masks and like earphones, and they've got, meditation tapes. Do what you need to do in order to get through that experience, because it is different for everyone. And apparently I'm going to start asking the nurses to tickle people. So I don't know the data there, but I like it.
It could be a good
Well,
study.
it would be an interesting study.
Doesn't cost anything.
Not at all. Just distraction.
Yeah. Yeah, just don't maybe make a loud noise or something. Yeah. Lori, did you have any big potholes on your journey?
Yeah, my incisions didn't heal. So my abdominal incision and one of my hip surgeries. So I had wound vacs, which are a blessing and a curse. They heal. They help you heal, but they are just not fun. And the changing them every week is, I mean, I think I had the abdominal one for a month. I think I had the hip one for 6 weeks, maybe more. And then after the hip surgery, I had IV antibiotics. I had a PICC line. I had IV antibiotics for 6 weeks, and that was a pothole. But with bladder cancer, unlike other things like the hip surgeons, like this never happens to me. Like, well, it just did. The bladder cancer community, I think, does a really good job of saying this is not a straight line recovery. You're going to have potholes. Which is the kind of information that's helpful. Now, they can't tell you what it's going to be, but the idea that this is not unexpected, whether it's wound healing or whatever you experience, that was very helpful to me because I had a framework. So when I went back to have this wound vac attached, I just said to my urologist, so this is one of the potholes you mentioned. And he said, yeah, this is one of the 2 steps back thing. So it wasn't, because we have this idea of that recovery is, I had the surgery and every day I'm better. And people will ask you, like, how are you feeling today? Crappy. Why aren't you feeling better than you did yesterday? I don't know. I wish I knew. So having that framework that this is not a straight line, that it's a long recovery, that there are bumps along the path, that was very, very helpful to me.
Karen, you've had the longest journey here. Have you hit potholes on your path that you can recall?
I said I was very fortunate in the doctor that I was given, and I really feel like I was fortunate in my recovery. My home health nurse was absolutely no help at all. It was wonderful that I didn't have any really major thing happen because I would have had no help. I learned by experience. Since I couldn't ask anybody about how my pouch was doing or why I had some leakage or, when you talk to the doctor, they say, it's a time issue. In time, everything will settle in. But nobody was telling me that the inflammation and the soreness and the pain and everything that I had was normal. So every time you have something a little bit different tweak you think, okay, what's this? I also had a fortunate lady next door to me who was a nurse. So she didn't know anything about bladder cancer surgery, but she was a nurse. And so I would ask her a lot of things. And sometimes in the healing process, you get these little tweaks and these little pains that shoot you. And she told me one day, she said, you've got nerve endings that are reconnecting. And so she said, this is all part of the recovery. And you don't realize, because it's such a major surgery and your whole body has been impacted with your digestive tract and your mental attitude with the anesthetic that's trying to work out of your body. Everything is, I felt like I was out there in La La Land. I wasn't really needing any extra information. My first UTI was a huge surprise, and it always is with the first one you get after your surgery because you're concentrating on other things, so it creeps up on you. But the tip that I would give you all is your major job after surgery is to develop patience, because everything is aggravating, frustrating, and annoying, and it will pass. It will get better. But when? Sometimes in a week or two, sometimes a month or two. So patience is what we have to have.
love to recognize, just listening to these potholes that we're calling them, and Lori, hearing you talk about having to manage a wound vac and and PICC lines and the anxiety of the cystoscopies and why am I getting a UTI and not really having a robust support system at the beginning of your experience. I would like to recognize not only the three of you, but all the people here who've had a bladder cancer experience and your caregivers. I get emotional when I talk about this stuff. It is extraordinary what we ask of people and what you all can do that you never thought you would have to do, and what you are capable of doing when you have to do it and there is no other choice. The things that we ask of people, those of you who are getting chemo or immunotherapy and coming to the hospital every 2 to 4 weeks for your appointments, coming every week for your BCG, being readmitted for UTIs, the extraordinary amount of courage and trust that you put into your team. It makes it such a privilege to be able to do this work, and I just want to recognize how extraordinary all of you are for persevering and for being here, for sharing, for being vulnerable, and for the three of you.
So I say, yeah, everybody applaud yourselves. You are literally building this bridge while you're walking across it. You don't know where the next step is coming from, and it is hard. And not everybody has a Mary Dunn in their corner. David's lucky because he rode here with Mary, so he's very lucky. So he's got Mary, but find that right person that helps you navigate what's going on. Caregivers have an incredible responsibility, and I encourage you all to remember, if you go down because you're not paying attention to your own health, where is your loved one going to be? You need to make sure that you're taking care of yourself as well, because you have an important role to play. And when you sacrifice everything, including your own medical care and routine screenings that you should have, because you got to take care of your loved one, then you're at risk. And if you're working together on this team, you both have to stay as healthy as you can be to keep going on the journey. So it's really important. You guys play an incredible role as that second set of ears and the note taker and everything else. But everybody is literally crossing this bridge and building it as they go. It's a challenge, absolutely a challenge. So what else, Mary? Any other comments and thoughts here? There's all, like I said, we have 4 pages of notes. Question? You have to speak really loud.
Okay. I'm sorry, I'm asking a question so I'm wondering if any of you had, during the beginning of your diagnosis, a urology nurse that acted as a care coordinator for you to help you navigate? No. Yes, you did.
I had a nurse navigator that I used a little bit, but I didn't need her a lot because it was pretty straightforward, BCG and BCG and BCG and BCG. But she was there, and I did call her. I actually did call her because for me, BCG is extremely painful. The urination is like peeing razor blades. It doesn't feel good. So I called her about how can I deal with that. So yes, in that respect I did. They gave me the, Azo or something, yeah. You just, not much. It's not much they can do for you with that I was experiencing.
So Lori and Karen, did you have anybody on the medical side to help navigate, to tell you where to turn or when to slow down when there was a A speed camera or something?
I had a wonderful ostomy home health nurse who was, she was great. And we stayed in touch for quite a while. But it, it was at the beginning of COVID, so I didn't really ever know what she looked like because she came in like in a hazmat suit.
Yeah.
But she was incredible with picking the right pouch, have a pouch, the right protocol for changing it, and she said a lot of things to me that I still reflect on. But one thing was, she said, pretty soon changing this pouch is going to be just another way you take care of yourself, like you floss your teeth. And at the time I was like, oh no, it's not. This is a major production every couple of days. But of course she's right, but hearing that for her it was very matter of fact. Well, for me it was an enormous deal. So she was great, and I, shout out to my husband who was there, for me for every appointment he could until COVID forced me to go myself, which was another pothole, because you don't have that second pair of ears and eyes. So that was another pothole. But yeah, she was amazing, and my husband.
I think it's pretty obvious with my age and the time frame of my surgery. I was on a urology floor, but none of the nurses that were working with me had ever seen an Indiana pouch. And so they were asking me questions, which I was thinking.
I haven't read the manual yet. I don't
Yeah,
know.
right. Dr. Blitz will be in, you might, but he was one of these perfectionists, and all the nurses were afraid of him. So they didn't want to ask him a question either. So they were hoping that I could tell them what was going on. And you've got all these tubes and everything coming out, and I didn't know what they were for either. But it was not the standard ileoconduit surgery that they had seen. So, the Indiana pouch is still in the minority with surgeons. So there's not a whole lot of people that are seen even on the big medical centers, to have the Indiana pouch. I think the Bladder is much more popular. So I would be happy to talk to anybody, one-on-one if you've got some questions about the Indiana pouch and how we work and how we live with it. Once you get through the initial recovery and living with the Indiana pouch, it's a very simple life. So I can expound on that personally if you want to ask questions.
Yeah. So now, bladder cancer treatments, those are sort of in the background. Other stuff comes up. How do you integrate having an Indiana pouch or an ileoconduit, or knowing that you have these treatments that you've had, and you've got issues with prostate? How do you integrate that into the rest of your health care going forward? Because we still have to take care of all the rest of our stuff. I know that Lori has a little story.
Oh, about the
Yeah, I think that was a good one.
So with my third hip surgery, I was really, really sick. And I had a nurse assistant, a young man, who came in after a couple of days, and he said, I have to change your catheter. And I said, well, that's going to be interesting because I don't have a catheter. And he said, well, it says right here in your chart you have a catheter and I have to change it. And I'm like, go ahead. I don't know what to tell you. But he had never, so I was on, but to his, I'm not defending him, he was kind of a jerk, but I was on an orthopedic floor, so I wasn't on a urology floor. So he had never heard of an ileoconduit. And so, I said, well, I'll be your instructor for the day. And I showed him the stoma, I showed him the pouch, I showed him how to attach to the night bag. And I said, there's no catheter, okay? And he's like, you're sure? I'm like, I think I would know, okay? So, but yeah, really, if you can find it. But no, he was so afraid of me. Like every once in a while they have to wipe you down with these bacterial wipes or whatever. He would just kind of throw them at me like, here, you do it. So I'm like, I think you're in the wrong profession, but maybe I'm not in the right person to tell you that. But there's a lot of education that goes on. As Stephanie said, this is not a well-known disease. People don't know that you're sick. A lot, I mean, we all fly, right? So groin anomaly, like, yes, well, I have this, why is there like liquid around your abdomen? Oh, well, and some TSA agents have never heard of it. So, I mean, there's a lot of education that has to go on that sort of demystifies it and, makes it okay to talk about. But yeah, there's a lot of misconceptions, and that was. Now it's funny. At the time, not so much.
Anything from you, Karen?
No. So, again, we call life after treatment the new normal often. People have told us that. It's like, this is my new normal. Okay, so we adopted that at Beacon. And, going forward, what can you tell our people here, all of them, most of them new to Beacon Summits? How can you give them some hope? How can you give them some tips for navigating the challenges? David, I'm going to start with you.
Okay. For me, exercise is extremely important. I have 2 times a week I go to a weightlifting online. It's online, but a weightlifting class where we do crunches and we do weightlifting, and then I walk a lot. Just to give you some hope, I'm going to do for my 70th birthday, which is coming up next year, I'm going to walk the Camino de Santiago, which is 500 miles. And I'm very excited about it. But I couldn't do that if I didn't take care of this thing, my body. And so what I eat, which I'm not always very good at, but what I eat matters. And I did early on, I spent a lot of time looking at diets and things like that, and I really focused in on anti-cancer diets and things like that, and lots of exercise.
And we're going to talk about moving through bladder cancer in the next session. And there's tons of information, including recipes, on bca.org. Remember, we're open 24/7. So look for some good suggestions on there as well. All right, Laura, your turn.
I would say there's an answer to whatever problem you're having, and you have to advocate for yourself, and you have to look for help. There are if you have a ileal conduit, the equipment manufacturers, Hollister, for example, a wealth of information about solving any problems that you have. Beacon, obviously, pelvic floor physical therapists, urogynecologists, psychiatrists. Sometimes you have to put your team together yourself, but they're out there, and there are people that will help you. And so if you have a question, don't sit with it. Get on the phone, get on Google, get on the Beacon website, look for the next step, and it might take a while to find the person that can answer this question for you, but there is help. There is help, and a great place to start is the Beacon website, because that's that can be your home base. But then you can go beyond and say, well, this is really a problem for me. What do I do? There's people out there to help you. So don't feel like you have to live with whatever is troubling you. There's people that can make that easier for you.
And I totally agree. Our mortal bodies are going to encounter an awful lot before we're out of this world. And we can get through practically anything, but it does not touch your spirit. You are going to be who you are, regardless of what happens to you through your journey. And if you keep that in mind, that cancer, misfortunes, any of those things that you have to live through really do not touch who the essence is of you. So you are okay. We have to rely on other people. We cannot do this alone. family, caregivers, medical professionals, you know, they're all there to help us. And if they're not the right fit, go find the right fit. I have worked with the support groups for years now, and I have found that the one-on-one, the eye contact, the ability to really interact is our saving grace. And it doesn't matter what our issue is. Sometimes just sitting and being in a room with someone without talking is the biggest help that we can give. So we live and we survive and we thrive. And the day comes that the issue that you had yesterday is not important. So, you know, I can just say we do not thrive when we continually do the what ifs. We've got to set some goals, work toward them, and we need to find out what our particular issues need. Those of us that have gone through the surgery, we have to know that for the rest of our lives, hydration is one of our biggest issues. And the things that we have to learn about our particular diversion, we've got to be experts in taking care of that diversion. The neobladder people have a particular issue, the Indiana pouch people do, and the ileal conduit people do. So we teach each other through the Inspire site. We teach each other through support groups and on one-on-one. So reach out to whoever you need to. And I highly recommend the Inspire site. You know, Stephanie knows I've worked on there for years too. And there is tons of information and shared experiences that really help you kind of miss over some of the potholes if you're paying attention. Mm-hmm. So, you know, if you think that you've got something that you can't wrap your arms around, just sit for a few minutes and let that issue and that pain kind of dissipate and then get up and go on. We tell everybody you can have a pity party for 5 minutes every day, and then you got to get up and move. 5 minutes, yeah. And it's okay. You can say, I don't like this, I don't want to do this. And after 5 minutes, you say, well, there's nowhere to run and nowhere to hide, so I guess I better get up.
Yeah. Okay, Mary.
But you can tell that I'm not.
I know.
Thank you all. Thank you, Kim. How do I follow that, Karen? That was beautiful. Thank you. But there were a couple things that you all touched on that I wanted to highlight. David, when you were talking about getting a second opinion, and it sounds like you were really listening to your gut and your intuition there, and it was right. I would encourage anyone, I know you all are kind of like beyond the getting a second opinion stage, but for those of you who are newly or recently diagnosed, it's fine to get a second opinion. I encourage people to get a
They
second
don't take
opinion
it personally.
if you have the means to do so. I don't have feelings left to hurt anymore. Please get a second opinion. Like, not going to hurt my feelings. Like, at the end of the day, it's your life, it's your body. You have to be comfortable with the people who are managing your care. So please don't feel like, I don't want to tell anyone how to feel, but it is okay to get a second opinion. So you're getting my permission, which means nothing, but it's okay to get a second opinion.
So Mary Dunn told me I can get a second opinion.
Please
so
don't
I'm gonna
use-
do it.
Use a pseudonym, don't use my name. And I also want to touch on, I know in cancer world, like we use a lot of language like hope and strength and fight and battle, and recognizing that not everyone identifies with those types of words like battling and fighting, because sometimes, you know, people have told me that implies winning and losing, and there's no losing here. No one's losing here, and it's okay to have a bad day. It is really okay to have a bad day. Give yourself permission to feel whatever it is you need to feel in that moment. It is okay to have a bad day. And then I think the last thing I wanted to touch on, there was a gentleman I had a really lovely conversation with last evening after our panel. He was here with his daughter. I'm sorry, I forgot your name if you're in here. There you are, yes. About, and I don't know if we have time to kind of touch on this, but how it felt to go from active treatment and to getting whatever treatment you're getting to all of a sudden treatment's done and you're not coming to the hospital all the time and you've got these big gaps in between your visits now, and that kind of feels like you're falling off of a cliff, and there's some like level of security and comfort, as much of a hassle as it is to be coming and being seen all the time, to all of a sudden there's gaps and you're not coming. So I didn't know if you all had any like worry or anxiety like when when you transitioned from active treatment into surveillance. And
You know, when my urologist said, well, you can have a CT scan every year now.
Yeah.
I said, no, I'm not. That's too long. I said, how about 9 months? So we compromised. But yeah, it's a real thing. And it just, you know, again, like I think we've all said, it takes time, it takes patience, it takes trust. And it also takes the idea that you know your body. If something feels wrong, you don't wait a year, right? You get on the phone and you do something about it. But yeah, it's an adjustment.
Experienced it all also, and it was weird because I felt like here's this doctor and this team of people that are holding me up, and all of a sudden the safety net is gone. But it really wasn't gone, but in my mind it was. They're still there. I can still contact them. But I definitely felt that loss of the safety net in my mind.
And I can agree to that. You know, going back and being this self-taught and learning with no experience or whatever, and my doctor was telling me after my surgery and coming back, and I had my checkup, and I thought, okay, I'm going to be okay. He said, we're going to be good friends. I'm going to be seeing you for a long time. And I looked at him like, why? And I said, really? And he said, yes. He said, we're going to be doing surveillance for years. And I still didn't have that book, and I didn't have a roadmap, and I thought, what kind of surveillance? So I really asked him, I said, what are you looking for? And he said, well, this particular cancer has a history of moving into the upper tract. And he said, so we're going to be watching to make sure you don't have anything migrate to the upper tract. And I said, okay. So, I thought that was okay. Then after the 5-year mark, and I was still doing CT scans and things like that. And I said, everything's fine. Do I really need to be doing all this? And he said, well, we just want to be sure. And this is going into like 206 or 7. Beacon is beginning to start things happening. Think Tank really hadn't got the protocols straight yet. So doctors throughout the country were doing different things. And that's the one thing that I want to drill down in your minds. Thank goodness for Beacon and Think Tank. Because Beacon pulled the scientific advisors together and got these doctors talking, they started putting things together like, well, no, we didn't do that. And, well, we're doing this. And so when they networked and got together, they decided, okay, maybe this works better. And protocols really came into being as to how do you treat people before and after surgery. Mary can probably expound on that a lot more than what I can. But here I was with my doctor, and he wasn't attending any of the Beacon stuff because he didn't know they were out there either. And when the first brochure came out, the Bladder Cancer Basics, I made sure he got one. And he looked at it and he said, this is good stuff. And I said, how come we don't have it anywhere? And he said, well, how can I get it? And I said, all you have to do is contact Beacon and they'll send them to you. So he has had them in his office for his patients all through the years. And anytime there's an upgrade, I make sure that his office staff knows to get out there and get them ordered. But this is just part of our journey in figuring out how we take care of ourselves down the road and why it's important to still be in close proximity with your doctors. And one thing that I have learned, we've got such a long way to go to educate the medical community. My endocrinologist, my gastroenterologist, and my urologist, and my GP, every time I get blood work done, every time I get anything done, I make sure reports go to all of them. They're not in the same group all the time. So that's my job. I'm the one that's saying, make sure he gets this. And living in Florida, you change doctors a lot, or they change us. So I'm always having to tell them what my Indiana pouch is and where it came from. Most of the GPs still don't have a clue what it is. And so I do a show and tell with them too. And, you know, it's really humbling to think that the medical community still has such a long, long way to go in internship with doctors. You know, they're specializing. And if they're not specializing in urology, they don't know.
So now everybody raise your right hand. I hereby deputize all of you to be the voice of the bladder cancer community and go forth and share with your healthcare providers that Beacon has resources and that you need them to share those with the other patients. Everybody agree? Say aye. Thank you. Okay. This has been a fabulous opportunity. I'm not going to open it up to question and answers. We have a little break to get you guys moving around a little bit before we get you moving around with the next activity. And I know that everybody will be available to answer your questions. So there is a break. There's some snacks outside. Thank you, everybody. This has been such a phenomenal panel. You're not alone. The journey is not easy, but you can get there. So.